we are now experiencing the fifth wave of COVID infection based on a review of the epidemiological curves for confirmed COVID-19 cases and reproductive rates to identify the inflection point for increased cases. This inflection point for the fifth wave occurred around April 20th, 2022. The inflection point is not immediately apparent. Clearly, there's a lag effect. It takes about 2 weeks, given that the assessment involves the use of data of onset of cases. We need to allow time for presentation to the healthcare system after onset of symptoms, sampling, testing of samples, and of course, reporting. This fifth wave is likely due to the Omicron subvariant BA.2, given the increasing proportion of this subvariant in the population and its higher transmissibility.